Hello everyone. Welcome back to our OCT series public lecture. Today, let's take a look at aspects related to measuring OCT images. We will briefly introduce the following 4 areas. First, let's look at the content of OCT measurements. OCT plays a very important role before, during, and after coronary interventional procedures. Before the PCI procedure, it can be used to determine the location and size of atherosclerotic plaques. It can also determine the reference vessel diameter, so as to guide stent size selection. Before and after stent deployment, it can confirm stent position, measure stent diameter, and assess the minimum stent area after stent deployment to decide if post-dilation is needed. Furthermore, after stent deployment, dissections may occur at the edges. OCT, with its high resolution, can detect even small dissections, helping to prevent these complications from being left after procedure. Additionally, in long-term PCI follow-up, OCT can assess for restenosis, or vascular remodeling. This illustrates the data acquired by an OCT pullback. Typically, one pullback acquires 400 frames of images. The user interface for this OCT system is relatively user-friendly. We can see that the angiographic image, the OCT cross-sectional image, and the longitudinal image can all be displayed simultaneously on the same screen. There is also a 3D vascular reconstruction effect that can be displayed on the interface. The measurements are also quite straightforward, because tools for measuring vessel area, diameter, angles, and adding text annotations are available. Operating it is just like using a smartphone app UCam Perfect, whereas many older systems were more like complex Photoshop with intricate interfaces. This system, however, has intelligently streamlined many functions. Many tasks that required manual input have been simplified, like in UCam Perfect. Therefore, the learning curve in clinical practice is shorter. This is the basics of OCT image measurement. Generally, on the cross-sectional view, we can measure the size of the lipid arc, its length, and also assess different plaque characteristics. On the longitudinal view, we can determine the exact landing zone for the stent and decide on stent length, size selection, and positioning, all of which can be effectively visualized with OCT. This is a set of OCT measurements for different plaque types. I'm showing you different types of lesions for measurement purposes. Looking at the top row, the third from left to right, we could measure the lipid arc, specifically its angular measurement. We can also measure the area of this plaque. Additionally, during measurement, we can measure the arc length. The triangular markers here mark the length measurement. Compared to the lipid arc angle, I personally think the arc length might be more clinically significant. This is because the angle measurement result relies heavily on the chosen of center points. If the center point is off, the measured angle can change significantly. Therefore, the arc length is likely more important. As mentioned in our previous lecture, we also measure fibrous cap thickness by OCT, and of course, thrombus size. The fifth shows a highly reflective, attenuated area, a typical red thrombus. The sixth is a white thrombus. The seventh might be less familiar. It shows the microchannels. The detection of microchannels serves as an imaging marker for the development and vulnerability of atherosclerotic plaques. We will cover each of these findings in detail later in the series. Now, comparing OCT to IVRs and angiography. OCT has higher resolution, offering a view similar to histology. It provides significant advantages in visualizing the fibrous cap, lipid core, and calcium. It is also very useful for thrombus assessment. while angiography can also suggest the presence of thrombus, what appears as a hazy or white area within lumen. On angiography, previously thought to indicate thrombus, is not always accurate. Such hazy areas could also represent calcium or other plaque formations. They are not necessarily the same. That's all for today.